Hello again. This is Dr. Dana Brackney. I'm a professor in the Department of Nursing at Appalachian State University. The objectives of this brief presentation are that you, the student, will practice using the first of four motivational interviewing core skills, open-ended questioning. There are four motivational interviewing skills, and these four skills can be remembered with the mnemonic OARS. That's OARS. The first of these, the O, is for open-ended questions, then A, affirmations, R, reflections, and S, summaries. Open-ended questions allow you to obtain more information more quickly and determine what is really on the patient's mind about a healthcare topic that you're interested in. Now, have you ever played 20 questions? In this game, you must only ask yes or no questions, so a very specific type of closed-ended questions. And you do this to determine what the person has on their mind. It's actually quite difficult. Imagine how quickly the game would end if you asked the open-ended question, like, what are you thinking about? Boom, that would be over. So though people give longer answers to open-ended questions, you obtain more pertinent information and it's more conversational in tone than not using open-ended questions. Continuing with our 20 question example, the person playing this game might say that they're thinking of a waterfall. And then the health professional in this example might ask an open-ended question. Please tell me about the waterfall. The person then responds, I went hiking this weekend and saw a beautiful little waterfall that sprung up out of rock along the Blue Ridge Parkway. This could lead to more specific questions that might be closed-ended, like, oh, where were you on the parkway? See, that's a closed-ended question because it has only one answer, but it takes you to the topic that's of interest to your client, and you're talking about the things that are on your client's mind. That's very important. Open-ended questions often start with a broad how, what, tell me about, very broad questions, and then they go to very specific questions following the person's lead. The purpose of open-ended questions is to place that person in charge of the conversation. As they're answering, they might say, oh, really, I don't know why I was thinking about waterfalls. I guess it's because I went on the hike, but really it was the trees that I really enjoy seeing. So note the expression of ambivalence, really not being sure what's really they're thinking about or what really was important to them, that enables the interviewer to evoke eventually change talk. When people answer open-ended questions, they often provide broad descriptive information in response, but it's okay. They might not come to a conclusion. Remember, this is more genuine, more real. And that's what we're trying to do with motivational interviewing. We're not just checking a task off our list. We're really trying to get to know the person, see their thinking process, and watch how they respond to the questions that we ask. So to recap, use open-ended questions to avoid this question answer trap. Open-ended questions place the patient or the client, depending on your preferred term, in an active role. So you don't have to think about what you're asking. You are the one responding. The patient is leading the conversation. It provides an opportunity for the patient also to explore ambivalence. It's really important that they do that because it will strengthen eventually their reasons for change and help them accomplish behavior change. Closed-ended questions, on the other hand, they are effective for emergent situations. Sometimes you just need information fast, like you need to know someone's allergies if you're about to give them medication. But they're not usually very patient-focused. They're more procedural in nature, but they are an important part of what we do in healthcare. Here are three close-ended questions. Go ahead and make some notes about this because in the LMS system, which is either Canvas or As You Learn, you're going to be doing an assignment turning close-ended questions into open-ended questions. So here's three closed-ended questions, and notice they're not yes/no questions. They are actually a single choice question, though, and that's what makes them closed. Do you feel depressed or anxious? Make that an open-ended question. Do you use drugs or alcohol? Make that an open-ended question. Do you binge drink? Make that an open question. I look forward to reading your answers that you post in As You Learn. And that's all that I have for you with this brief video.